Welcome to the first module of Open WHO's online training on social prescribing. By the end of this module, you will be able to answer the following questions. What is social prescribing? Who is social prescribing for? Why social prescribing? How does it address the social determinants of health? How does social prescribing fit in the WHO Western Pacific Regional Action Plan on Healthy Aging? Who are the link workers, and why are they key to social prescribing? Who can fulfill the link worker role? How is social prescribing supporting person-centered care? What is new about link workers and social prescribing? Social prescribing is a means for healthcare workers to connect people with social, non-medical needs to a range of services in the community to improve their health and well-being. Non-medical issues linked to anxiety, low mood, or loneliness can be treated using social prescribing. Social prescribing aims to build on individual strengths and preferences to improve life quality. Social prescribing is a more holistic approach to healthcare, which promotes community-based integrated care. Instead of simply treating the symptoms, social prescribing can help to address the underlying causes of patients' health and well-being issues, and thus it can also be beneficial in reducing unnecessary medicine consumption and health services use. The exact nature of social prescriptions, meaning the referrals of patients to activities and services, are specific to each community and care setting. Yet, social prescriptions typically include referral of patients to community mental health services like counseling and therapy sessions, self-help groups, or weight loss and diet support. Social activities such as coffee gatherings or conversation tables. Financial, legal, housing, welfare and citizenship advice. Physical activities like community sports clubs or various outdoor spaces and parks. And cultural and artistic activities such as art classes, museums, libraries, reading groups, or language classes. In the most common model of social prescribing, primary healthcare providers like doctors, nurses, or clinical staff can refer patients to specialized link workers who work with the patients to identify their social needs. The link workers typically contact patients by phone or meet with them to co-design personalized plans to improve their well-being. They also routinely follow up on patients to monitor their progress and make use of behavior change techniques. The link worker model can be adapted to each unique context. For example, the link worker responsibilities could be fulfilled by existing staff like social care workers, community workers, or nurses, or by an organization such as a community-based NGO or a newly created position. So far, social prescribing has been implemented in several countries, including the United Kingdom, Portugal, Republic of Ireland, Canada, Australia, New Zealand, Singapore, and Japan, with early pilots taking place in different parts of the Western Pacific region, such as in China. Let's watch a short interview of a professional explaining their experience of leading the development of a social prescribing scheme. Social prescribing can benefit anyone who experiences non-medical social issues affecting their well-being and social participation. However, evidence shows that those populations who are the most disadvantaged to begin with are likely to benefit the most from social prescribing. Social prescribing is therefore a type of intervention which may help to reduce health inequalities within a community. The populations who are most likely to benefit include the following: people with chronic health conditions, people at a high risk of mental health issues, people who are lonely or socially isolated, and people who are vulnerable, for example, because of their age or their financial situation. To learn more about who is social prescribing for, watch this video interview with a practicing link worker. Social prescribing directly aims at addressing the social determinants of health, also known as SDHs. This approach is key to improving health outcomes. According to WHO, the social determinants of health, SDH, are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. These forces and systems have an important impact on people's health. Examples of SDHs include the following: income and social protection, education, unemployment and job insecurity, working life conditions, food insecurity, housing, basic amenities and the environment, early childhood development, social inclusion and non-discrimination, conflict, access to affordable health services of decent quality. Issues in any of the following can impact negatively on people's health with variable intensity. Social prescribing schemes, by helping individuals to navigate available resources and reconnect with communities, can help address some of these issues, and therefore positively act upon the underlying causes of people's ill health. Now, let's have a look at the following situation. An older man living alone in the periphery of a small town recently lost part of his mobility following a fall. He feels lonely at home as he is now unable to visit relatives in the nearby town. He mentions feeling lonely and unwell to his doctor during a home visit. The doctor proposes him to meet with a link worker who may be able to help. The older man accepts, and the next day he receives a visit from the link worker. The link worker is aware that there is a day center offering a singing group followed by a lunch every Saturday. They were recently subsidized to offer a shuttle service for people with limited mobility to attend this particular activity. He discusses this possibility with the older man, who agrees to take part. The link worker contacts the day center to arrange for the shuttle service to pick up the man the following Saturday. The following weeks, the man enjoyed some company every Saturday, easing his loneliness and improving his well-being as a result. He made further plans with the link worker and the day center so that some of his relatives could enjoy lunch with him at the day center from time to time. Based on the situation, think about the following questions. What are the health issues experienced by this older man? Which one of these issues can be most directly addressed by targeting the social determinants of health? Which social determinants did the link worker target and how? Research has shown that loneliness potentially caused by social exclusion can be an important factor influencing health. In this regard, one of the ways social prescribing can help addressing this issue is by offering support to attend a regular activity group like an art class, a discussion group, or in this case, a singing group followed by lunch every Saturday. These activities can address social isolation and loneliness in the patient. Of course, There are many other ways in which social prescribing can help to improve well-being, ease anxiety, loneliness, or depression by seeking community support and services for patients experiencing difficulties which do not require medical intervention. Here are some other examples on how you could address common SDHs as a link worker. You could accompany a person to a job center if they recently lost their employment. You could accompany someone experiencing food insecurity to a nearby food bank. You could support someone with a disability living in inadequate housing to link with services who can make necessary adaptation in their house. You could liaise someone with alcohol-related addiction to a support group. You could refer a person experiencing poor health and loneliness due to sedentary life to a sports association in their community. As said earlier, social prescribing is particularly useful to support people that are most disadvantaged in society. By serving disadvantaged populations, social prescribing can therefore help to positively influence the SDHs and reach more equity in health. However, it is important that social prescribing should not be used as a means to divert patients from the health services they need for cost-saving purposes. It should keep patients' well-being as the central objective. A good example of how social prescribing can support healthy aging in the Western Pacific region is the Regional Action Plan on Healthy Aging in the Western Pacific, published by WHO. Among its core objectives, the Regional Action Plan on Healthy Aging in the Western Pacific aims to support older people who are healthy, thriving, and contributing in society. Social prescribing especially relates to an important objective of the Regional Action Plan when it aims to provide community-based integrated care for senior citizens tailored to their individual needs. As presented in the plan, improving health in later life requires a whole-of-society transformation. Addressing the SDHs is integrally part of this whole-of-society approach, and social prescribing therefore plays an important role in supporting healthy aging in this region. Here is a model presenting the different components of community-based integrated care necessary to improve people's health in later life. This model indicates how link workers are instrumental in coordinating the provision of community-based integrated care by supporting older adults to access different social activities and services. Link workers help patients individually to navigate across health care, long-term care, social activities and services, with the central objective of helping them to live autonomously at home for longer. Link workers are therefore essential in coordinating the different aspects of community-based integrated care. We will now look more closely at the role of link workers, who are critical to the success of many social prescribing schemes. Link workers are key actors supporting the model of community-based integrated care that we have seen previously. The link worker is someone who has a good understanding of the community they serve. They can effectively and compassionately connect patients with community resources that will meet their needs. The role of the link worker is to empower people by playing an integral role to manage their health and well-being. The link worker should aim at building a trusting relationship with the patient, actively listening to their concerns to understand what matters most to that person. The link worker then works together with the patient to develop a personalized well-being plan and connect them with the services available locally. Link workers are usually part of a team with health professionals and community organizations. This integration improves their ability to coordinate services when patients are being referred from health services to community activities. Link workers are brokers bridging health services and community organizations in providing holistic care to patients. Let's have a look at the most important requirements regarding who can fulfill the link worker role. First of all, link workers must have a good understanding of their communities and ideally have experience supporting patients. Recruiting link workers may involve hiring new personnel or shifting or expanding the role of existing professionals. For example, nurses, caregivers, occupational therapists, social workers, community outreach workers, health promoters, or community volunteers. A central aspect of the link workers' practice is to adopt a person-centered approach to care. Let's see what it means in practice. Important aspects of person-centered care involve informing patients about their health in view of helping them to make decisions, empowering patients to take part in decision-making regarding their health together with healthcare professionals, developing personalized care plans based on patients' preferences and needs, and encouraging patients to self-manage the social determinants impacting their health. We will see in the next modules how this approach influences multiple dimensions of the link workers' practice. Let's watch a video interview about what are the most important qualities of a link worker.
Hi, my name is Daniela. I'm a Wellbeing Coordinator at SingHealth Community Hospitals. As a Wellbeing Coordinator, our main role is mainly to interact with patients and provide a social prescribing plan for patients after they are discharged. So we see patients on a daily basis. We provide our time to hear them out on various concerns during their hospital stay here. Therefore, the patients trust us and tend to share more with us on their social concerns as we are there to lend a listening ear and they have time for longer conversations with us. Each patient have different needs and wants. We always try our best to cater to each individual patient needs. For example, some patients enjoy listening to music, so we will definitely check with them whether they have a favorite song or a favorite artist. Then we will play the song that they have requested for. While other patients, they prefer doing activities such as word searches or coloring. Sometimes we are also faced with some patients that definitely tend to take time to open up to us. We try to visit them every day so that they will be able to recognize us so that we can actually build a rapport with them. When the rapport is actually built, these patients inform us or share with us more about their feelings or fearfulness. This can be fear during their hospital stay or what happens after the stay. So we share these relevant informations with the clinical team to actually collaborate and make the best plans for our patients. Based on my experience, I feel that to communicate well with my patient, firstly, it's important to be attentive, and secondly, it's important to also have an open mind.
An ideal link worker listens actively and empathizes with the patient, communicates effectively, can foster trusting relationships, can build and grow community networks, is knowledgeable and passionate about addressing the social determinants of health, ideally has some experience of working with patients, and can speak local languages and is sensitive to the local culture. Furthermore, there are some aspects that identify the special role of a link worker. An ideal link worker does not simply inform patients about community resources, but actively helps them to access these resources. Furthermore, an ideal link worker does not simply provide advice on how to stay healthy, but actively supports the patient in developing and implementing a well-being plan that both addresses social and health issues. To summarize the difference, an ideal link worker does not simply do things for the patient, but always aims at supporting the patient to become autonomous in sustaining habits, improving their well-being. Throughout this first module of our training, we have discussed about the basic principles of social prescribing and the importance of link workers. As you can see, what is new about link workers and social prescribing is that they systematize connections between the health sector and community partners in the treatment of patients. Although doctors can play a role in informally signposting community activities, what social prescribing does is to formalize this signposting into an actual referral process and to actively support patients in implementing behaviors and initiatives that can improve their health and well-being. To summarize what we have learned so far, let's watch this video interview with a practicing link worker.